Hi, welcome to 5 Minute Video Study for the NCE. Today we are going to be, the category is clinical focus, and we're going to be talking about subcategory AG, spiritual and existential concerns. So these are concerns that many people face throughout the lifespan, really. Because a spiritual or religious concerns are also kind of tied in with the notion of the existential. Many times that is tied in with individuals going through a serious illness or a serious accident because they realize that their time is limited on Earth. So that kind of brings up a whole spectrum of issues where people start to question, how do I want to spend my time that's remaining? Or do I even have much time remaining, right? And that can put someone in certainly a existential crisis. First, with the notion of any illness or any event that could kind of spark some of those concerns, those are events that have a high risk of mortality, right? So here, with existentialism, you are faced with that notion of mortality. And, I would say on day to day, most individuals don't necessarily have that in front of them, because on a day to day, that's something that, even though I would say most individuals acknowledge, it's not something that they're necessarily faced with on a day to day. So, a clinician or a health professional is someone that can assist, and you might see, the clients, especially if you're working in a hospital or you're working in an institution where these individuals have to, come across their own type of mortality and how those spiritual or existential notions intersect, right? And with spirituality or religion, it's important to remember there are many types, and even within types, there are many subcategories. And even with that, there's many titles, right? You have a bishop, a cardinal, a chaplain, a clergy, a deacon, a pope, a preacher, a priest, a rabbi. So those are just some of the terms that could be used for, spiritual leader. So with spirituality, that to me, that's more a broad term, and that's just the aspect of humanity where individuals try to seek meaning or purpose or find that connection. And it could be a connection in nature, it could be a connection with something that they find significant or that they find sacred. So that's more general term. It doesn't necessarily have to belong to an institution to be or to practice spirituality. Spiritual distress, that is suffering related to meaning in life, lack of connection, or impaired connections. And again, many times that come because of an illness or an event, or people realizing their own mortality. And then spirituality is recognized as a fundamental aspect of that, finding that care and finding that connection, really. So spiritual or existential needs or can include to finish businesses, so such as asking for forgiveness, reconciling with family or friends, or reviewing their lives for meaning, to have involvement and control in their care, in their medical decisions, hospitals as well as environments, if they are going through accidents or illnesses. And to maintain a positive outlook by utilizing spiritual strengths and personal resources to keep an open mind, and most importantly to live in the present, right? And that's where that connection, that autonomy, it comes into play, right? And some of the spiritual distresses or existential distresses would be the fear of death, fear of leaving loved ones, fear of pain, fear of suffering, fear of being forgotten, and fear of not leaving a legacy. Another spiritual distress or existential distress would be loss or grief, the loss of independence, mobility, life, and really the loss of control. And then other distresses could be despair, anger, frustration, and helplessness. So in the final thing is for clinicians to understand that the existential is a journey to find their meaning, to find self-discovery, and finally to seek certainty in the uncertainty, or in the ambiguous world. And for many, that's certainly a journey, a continuous journey, for many that certainly requires a lot of self-reflection.